Well, folks, I mentioned it's been 10 years that we've been coming to Battle Creek, and in those 10 years, we've had the great pleasure to talk to this community about how the brain works, about how diseases can affect the brain, about possible treatments for those diseases. But something we've never really talked about is how that information comes to be, and the process by which new information is discovered, and more specifically, what happens when that process gets taken advantage of, or when that process goes wrong. A thing happened in the neuroscience community this year. It was one of these things that Anne became aware of, and we agreed it was a pretty serious thing. Some people's lives were put very much at risk, and we'd like to talk with you about what happened. Just as a heads up, neither Dr. Counts nor I were involved in this, but we've been asked to come and talk about it. And I thought it was a good opportunity to talk about how the research process and the clinical study process can become compromised. So that's my plan today, is to talk to you about what happens when trust in science is damaged and how that happens. So let's start with the good news. Well, the good news is that there was a recent study in Nature Human Behavior that said that trust in scientists across 68 countries, this is approximately 72,000 people from 68 countries, trust is decently high. So trust in scientists was ranked at moderately high on a scale of 1 to 5, 5 being the most trust, 1 being the least trust. Scientists got about a 3.62, not bad. It's trending in the right direction. I would like it to be higher, but that's where we are. No country of the 68 shows low overall trust. The United States was number 12 out of 68 in terms of how much people trust scientists. People perceive scientists as having high competence, score of 4 out of 5, that's not too shabby. 57% of respondents believe that scientists are honest. That means that 11% believe that they are dishonest, actively dishonest. 31% selected the scale midpoint, meaning, 75%, however, agree that scientific research methods are the best way to find out whether something is true or false, and I agree with that. But what that means is you can believe that science is good while questioning the integrity of the scientists doing that work, and I think that that's a healthy skepticism to have, and scientists should be expected to prove their trustworthiness to you, and there are some things that they can do that can undermine that trustworthiness, and I'm going to talk about a couple of those things right now. It has been a rough year for neuroscience. In the last 12 to 18 months, some very embarrassing things that have happened. We're going to talk about a couple of those, but it's been a tough time. The work is still necessary, and I genuinely believe, and I believe my colleague Dr. Counts will agree, that the majority of work is still very good. The majority of scientists are still upstanding, integral people, but there are some bad apples in the bunch, and we want to talk about that to help you know sort of what to make of those bad apples. So we're going to talk about 4 things that can imperil trust, and we're going to start with the least egregious, the least problematic of this, the most sort of accidental of these, and that is simple errors in publication. One of the most famous scientists in the world is a man named Thomas Sudoff. He's a Nobel Prize winner. He helped us understand how synapses work and that they work, right? So critical stuff for understanding the brain. He's published over 600 papers. He's worked with all sorts of people, published books. And when folks were looking back at his papers, they identified 15 that they said, the data here, we're not sure if this is correct or not. And a lot of those things were what he described as simple copy-paste errors. So they were supposed to put this picture in that spot, and instead they put a different picture in that spot. And when asked about it, one of the postdocs, so this is a person who is in the lab, they have finished their PhD, they don't yet have their own lab, they're responsible for making their career. So their job is to do science well enough that they can then get a job doing science professionally. The postdoc who was responsible for one of these errors talked about the process and said, errors happen, but they don't affect the outcomes of these papers. And the reason is that outcomes, these findings, are based on multiple experiments using different techniques, multiple independent repetitions of these techniques by multiple investigators, all in a blinded manner. So papers are the result of often multiple labs working together. People should be repeating those experiments in different ways to make sure that the finding holds up. And so if one little thing got copied and pasted, yes, it's an error, but it doesn't mean you throw out the whole paper. And I would agree, these are very big papers and mistakes do happen. So we can assume best will on this one and say, okay. And so they retracted 2 papers, meaning they pulled them out of publication, and they added corrections to 5, saying, when you read this, we forgot, we meant to put this in, and instead it was this, and that's the way you go. Science, I think there's a misconception that science is somehow perfection. Science is imperfection, imperfect people, imperfect techniques. imperfect ideas striving for perfection. And the way that we get that is through repetition and through working together, and we're all saying, did you find that thing? Oh yeah, I found that thing too. And that holds up the trust in that belief. So mistakes do happen, but I wouldn't say it's a good enough reason to shake the foundations of the field. Redacting these things can be really stressful for young authors, especially for postdocs, because they're trying to make their career. And if their career is that they publish a thing and then they have to take that thing back, that raises questions about their credibility and their employability. And you can imagine that that might create pressure to not correct things, right? To not admit that you made a mistake. So that's something we need to be mindful of in the field of science, and making sure that postdocs feel safe saying, I made a mistake, I'm going to fix it, here's the correction. But there are those who engage in willful active misconduct. We're going to talk about a couple of those cases. We're actually going to start with a case that doesn't relate to neuroscience directly, but I think it's sort of the Rosetta Stone case for understanding scientific misconduct. And that's going back to 2005 with a guy named Eric Pullman. Eric Pullman is the first scientist to serve jail time for falsifying data. His entire career was based on falsehood. Many, many years, many, many papers, all based on falsehoods. He studied obesity and aging, but he had a trick, which was that he was never the one finding the thing. Someone else would find a thing, and then he'd publish a paper saying, oh, I also found that thing. So he wasn't really raising too much attention. He had a student working in his lab, and the student was brand new to the lab, and the student did an experiment and found that the results he got in that experiment were directly opposite of what the lab had been publishing. But he knew he had done that experiment correctly. So he went to the boss of the lab, and to Eric Pullman, and he said, strangest thing happened. I've got these numbers, and they're completely opposite of what we've been saying. And Eric said, well, let me take a look at them over the weekend, and I'll come back and we'll discuss them on Monday. When he came back on Monday, he said, don't worry, I figured it out. The numbers are just fine. And the student looked, and Pullman had changed the numbers so that they aligned with what they'd been publishing. What is this student to do, right? He is brand new in a lab. This guy is established. He's got a multi-year career studying this stuff. What is he to do? So he reaches out to other people in the lab, people who'd graduated from the lab before, and they said, we had some questions, but like maybe don't ask about it, just get your stuff and get out. So the student was undaunted, and he reached out to a collaborator, another scientist, another faculty person, and he said, I have these concerns. What do you think I should do? And the faculty person gave him this advice, which is terrible advice, and yet frequently given in these situations. The first was the faculty person told the student, no matter how you proceed, everyone loses. No good will come from this. Your career will be ruined because no one is going to protect you. The university will come out bad, and Eric's reputation will be destroyed. If you're going to do something, make sure you really have the evidence, meaning putting the pressure on this student, right, a brand new PhD student, to do all of this work. Well, thankfully, the student did all of that work and compiled the evidence and took it to court, and this guy was found guilty and went to jail for this. And in his defense, he said something that I think is very interesting. He talked about how he had had success early on, and that success had gotten him a bunch of funding and had gotten him a lab and people working for him. But then he couldn't repeat that success. And he felt pressure and he thought, these people are working for me. I need to keep it going. So he started to fudge the numbers a little bit. What's the big deal? I'm going to find another thing. I'm going to do something else. And it just wasn't happening. So over time, he said he placed myself in an academic position where the amount of grants basically determined one's self-worth, and everything flowed from that. With that grant, I could pay people's salaries, which was always very, very concerned about. He had about 40 people who had kids working for him. He says it created a maladaptive behavioral pattern. He was on a treadmill he couldn't get off of. Now, obviously, this is after his sentencing, so he's not trying to convince anybody to not sentence him. But it does raise this question that we have created an industry of research that there's so much pressure to find new things. And then once you found a new thing, you got to find the next new thing. So much pressure that none of what I'm saying is to excuse the behavior of these scientists. It is merely to try to understand the behavior of these scientists. And where do we go from here? So bring it back to neuro and things that affect this population, and talk about Mark Tessier-Levine. Mark Tessier-Levine is a very significant figure in the field of neuroscience, has published on everything from synapses to spinal cord development, all sorts of things. And he was at a company called Genentech, a very big multi-billion-dollar company that works on biomedical stuff. And he had a postdoc working for him. And again, this is a postdoc who's trying to make his name in research, trying to get a job. And the postdoc finds something, and they publish it in a 2009 paper. And what they find is that amyloid, which you heard our students talk about earlier, that amyloid could directly cause the death of neurons, could directly cause dysfunction of neurons. This is something that people had thought about for years, but the evidence of it was very, very lacking. So it was a really big deal when somebody says, I found it, I found the mechanism by which amyloid is affecting these neurons. Wow, what a big deal. It immediately, it was described as groundbreaking, that spawned these patent and intellectual property things all over the world. This is an internal slide from Genentech at the time to their investors saying, look at all these headlines we're getting. We've made this huge, giant discovery and it's going to open up all this new stuff. And in a letter to their shareholders, they said that because of this research, we're going to develop new antibodies and small molecules. And we found all these new ways to address Alzheimer's disease. And indeed, this is part of the body of work that led to these anti-amyloid antibodies that you've probably heard about and we'll talk about a little bit. So the problem was that as early as 2011, Genentech discovers they can't reproduce these experiments. They don't work. And there's a story that may be apocryphal, but I think is interesting, that they took this postdoc and they said, we need you to repeat these experiments. And they gave him purposely faulty ingredients. And he came back and said, I found the same thing. And they went, oh my God. So 2011, they know that things are bad. Following this, they suspend all research based on this 2009 paper, and Tessier-Lavigne leaves the company and becomes the president of Rockefeller University. The postdoc, who was the first author on this, right, the one who's doing all these experiments and the one who is fudging stuff, or seems to be fudging stuff, he leaves Genentech altogether, which is unheard of. If you could get a postdoc at Genentech, it was like your career was made, right? So the trouble is, they knew about this internally. So there was a scientist who was later interviewed who said, they told me that the project was being canceled because they found falsified data. That's 2011. Problem is they don't retract that paper till 2024, late in 2024. And it has been cited over 1,200 times. What a citation means is a scientist like me reads this paper and says, good, I'm going to use this as a piece of my evidence in my paper. So I'm going to say this does this, and I'm going to put a little citation that says that's where that comes from. But now that citation is false, and 1,200 times it's been cited, and 17,000 times it's been viewed, presumably by other scientists who are sort of charting their path through science. Tessier-Lavigne, who in 2024 is the president of Stanford University, there was an investigation at Stanford, and they said they cleared him of misconduct because how could he have known what was being done in his lab? He had so many people, and he can't be required to know everything that was going on. I leave it to you to decide whether that's a fair judgment or not. But he resigns as president of Stanford University. And the postdoc is now a radiation oncologist and is now seeing patients. How big of an impact can one person have? So that's a very bad situation, but it's one person and, it's a couple of papers. One finding, right? What if it got worse? So this is another case that came out this year and was in headlines and really put a black eye on neuroscience, which is that of Eliezer Masliah. Eliezer Masliah had a really significant career, decades and decades of research. He was named head of the National Institute of Aging's Division of Neuroscience. So all the Alzheimer's funding that comes through the government comes through this. It's a $2.6 billion budget, so he's named head of that in 2016. He has over 800 papers. He's one of the most cited neuroscientists. I'll show you just how cited. And he's working on synaptic dysfunction in Alzheimer's and Parkinson's and things like that. And he's also helping to characterize these mouse models that we use for research. So the journal Science, which you heard one of my students mention, Nature is a big journal, Science is another big journal. They get tipped off that there's some questions about his papers. So they commission an independent investigation. And they find problems in 132 of those 800 papers, which if you're doing the math is about 16.5%. That's what they've found so far. Just how cited was this guy? So this chart talks about this is his work, Masliah's work, in the field of Alzheimer's, the total number of papers for each of these things, the world rank for how many, who has more papers than this. So let's say Synapse, right? Synapse in Alzheimer's, he's the #1 guy in the world for number of papers. And he's #2 for citations. And he's got 18,000 citations. For amyloid and Alzheimer's, he's number 30 in the world for the number of papers. #9 for citations, he's got 55,000 citations. So you imagine sort of the determined law as fruit of the poisonous tree, just how far these errors may have gone. In the field of Parkinson's, he's #1 for synuclein paper, Number 3 for citation, 30,000. So this is, tens of thousands of times this guy's been cited. So Maslia, he also had papers that have come into question that were used to justify the creation of an anti-synuclein antibody. So just the way we have anti-amyloid antibodies, we have an anti-synuclein antibody that was tested based on his work, and it didn't work. So the New England Journal of Medicine, they did a clinical trial, 316 patients, no effect, but they did get a bunch of headaches and nausea. So the journal Science shares their dossier with 11 leading researchers, and all agreed that there was clear evidence of data manipulation. Sam Gandy, who's a neuroscientist I like, said there were hundreds of images. There had to have been ongoing manipulation for years. The bus driver could see that they were identical. I'll show you the identical images in a second. And the NIH did their own study and retracted 2 papers and then removed Maslia from his position. So, identical. What you are seeing is a panel from one of his papers, and the little words here, don't worry about that, I'll explain what that is. He's effectively showing whether or not this drug does anything to help these transgenic mice. And these transgenic mice have a form of dysfunction that's sort of like Alzheimer's disease. And what he's showing is that the one down here, which has been treated with the drug, looks the same as the one that doesn't have Alzheimer's, it's just a healthy mouse. Wow, that would be great. That would be like, oh, you have Alzheimer's, we give you this drug and you're back to normal, right? That would be great. Except it's the same picture, literally the same picture. So if you color one of them red and one of them green, and you put them over top, anything that's yellow means it's the same pixels. Now, an astute, eagle-eyed observer may say, but wait, there are some red spots in there. It can't be the same picture, right? Well, further investigation discovered that Maslia would copy pieces of the image onto itself to make it a different image. Clever, right? Because who's going to do that work? Well, it turns out that there are people and there are tools now that allow us to examine these sorts of things. And what they find is that these pictures have been doctored. Additionally, there is a test, Dr. Counts will agree, is sort of the bane of all scientists. I have run hundreds of Western blots in my life. And you want the lanes to look the same. You want this to look exactly like this, but they never, ever do, ever, except in Maslia's paper. They look the same. They've even got the same air bubble, which doesn't happen. So, a lot of concern about the quality of these papers. But remember, this is the guy who is now in charge of deciding who gets funded for all of Alzheimer's. So, before we get there, he's also helped to characterize these mouse models, which are being used by labs all over the world as examples of Alzheimer's. But if that characterization isn't accurate, then the stuff that calls from that isn't accurate as well. It becomes very, very difficult. And there's been no evidence of malfeasance in terms of what he was choosing to fund, but certainly it is true that if you are a scientist looking to get funded, you're going to look at who's deciding on the funding, and you're going to try to say, well, I'm going to study the stuff that's going to get funded because I got to fund my stuff. So it is a big, big problem. He has now been removed. Somebody else is in charge. There are countless other labs who are trying to make sure that this work, the things we need to know are true, all that sort of stuff. One guy's not going to ruin everything, but he has this enormous impact because he decided to manipulate these things. The third thing I want to talk about is a flood of garbage. So this is happening right now, and thankfully, people are getting out in front of it. But in December 2023, the publisher Wiley, who publishes a lot of scientific journals, said they would close 19 scientific journals and retract 11,000 papers because they were riddled with AI. People had used AI to publish all these journals. Why? Because your job depends on publishing. The term is publish or perish. So people were trying to make a name. They'd publish papers in these made-up garbage journals, and they'd put them on their resume, and nobody checks when we got all these papers. That's great. Turns out they were just garbage papers. So we're getting a handle on that. The fourth, which is the thing that happened that Ann and I decided would be important to talk about, was mishandling of clinical trials. So there was this fiasco with Aduhelm. You may remember we've talked about this before. This was an anti-amyloid antibody intended to help treat Alzheimer's disease. And the trouble was when you put it in people, it caused brain bleeds and other things like that, and it didn't seem to have a therapeutic effect. And it ended up getting approved by the FDA, despite a lot of people saying it shouldn't have been. And once it was approved, a bunch of medical systems, including University of Michigan and other places, said we're not going to carry that drug because we don't think it has an effect. So after this fiasco with all this brain bleeding and stuff, the FDA recommends that you exclude anybody in your clinical trials that has a history of microbleeds. Why this matters is the people who are most likely to have these microbleeds are people who carry a gene called ApoE4. ApoE4 is the fourth ApoE protein, and it is the worst at its job. Its job is to clear amyloid out of the brain, but it's just naturally not very good at it. So if you have 2 copies of ApoE4, you are the worst at clearing amyloid out of your brain. We want to study those people because if an anti-amyloid drug is going to work, it's going to work most in those people who have 2 copies of ApoE4. So they're very attractive for a clinical trial idea, but the risk is microbleeds. So the FDA says don't include those people with microbleeds. So at the Alzheimer's Association meeting that year, which would have been 2010, a group of researchers from medical science and industry, all these different companies like Genentech and other folks, they get together at that meeting and they decide on some new guidelines now that the Aduhelm thing has sort of blown up. And these are the guidelines that they agree on. First, they're going to allow 4 microbleeds per patient. Great work, everybody. They decide to rename vasogenic edema and microbleeds to a term amyloid-related imaging abnormality, or ARIA. I don't know for sure why they did this. I imagine it's because ARIA sounds a lot better than brain bleeds. But a good thing that they did was they said participants would be informed of their genetic risk from ApoE4. So if you have copies of ApoE4 and you're going to go into one of these trials, you should be told, hey, you've got copies of this gene that mean you are most likely to get brain bleeds. However, Eisai, which is a company that makes Leqembi, you may have heard about, and Eli Lilly, who make donanemab, decided not to do that. They decided not to inform their participants of their genetic status. Why? Well, we're going to get into that a little bit. Participants were asked to sign a form that said that they knew that there were higher risks and that they'd be tested for this profile, but that they would not be informed of the results. They would not be informed, their doctor would not be informed, their family would not be informed, they would not see those results. And participants were told, well, just assume you have the highest level of risk. Well, nobody's going to do that. Of course nobody's going to do that. So you have all these people who are desperate for a cure. They want to be able to spend time with their grandkids or their family. Their families want them to be able to spend time with them. They want to, not progress in their dementia. They're hoping that this will give them a chance. Of course, they're going to say yes to this unless you tell them you have this risk of brain bleeds, which they decided not to do. So what happened? Well, later in its defense, Eli Lilly would point to research showing that people who knew their genetic profile in studies may skew their self-reported measures. So a lot of these studies will say, do you feel different? And you write down your answer, whatever. And if you apparently have this genetic predisposition, that can affect your results. And they felt those results were vital, so they didn't want to tell people. The Eisai study was approved by an external IRB company. So at a university, like Dr. Counts and I are at MSU, so any research that we want to do has to get approved by what's called an institutional review board, which is a bunch of people who their whole job is to make sure that the research is safe. For industries, for companies like Lilly and Eisai, they don't have that. They contract with an external company whose job is to approve these things. Well, obviously, it's in the interest of those companies to approve things because they're going to get paid. And somebody from the IRB company who approved this study where they weren't disclosing risk said, I'm afraid at this time I'm not going to be able to get you answers on why we approved this thing that is so dangerous. The Leqembi trial had 274 people in it with copies of ApoE4, and 100 of them developed brain bleeding. How many of them would not have participated had they known their risk? I can't say. Eisai reported no deaths during the 18-month trial, but since then there have been at least 23 deaths linked to these side effects. Eli Lilly has now changed their policy, and participants have the option of learning their genetic profile before the trial starts. So now they are getting it right. I want to wrap up with this quote. The person says, I'll give you a quick example. 20 years ago, NIH scientists did a study of Alzheimer's. They said it was caused by the amyloid plaque. After that, NIH shut down studies of other hypotheses. 20 years later, we know that those studies were fraudulent. This is in reference to a single study that I didn't talk about tonight, where there was a fraudulent evidence put forth supporting this amyloid hypothesis. NIH has funded 800 studies on a fraudulent hypothesis, and we've lost 20 years in figuring out how to a cure for Alzheimer's. So just one example, I could give you hundreds. We need to end that. We need to end the old boy system. We need to have replicatable science and be completely transparent about broad data. There is a growing sentiment that this needs to change, and this is actually from RFK Jr.'s confirmation hearing. I don't agree with everything that RFK Jr. says, but I do agree that we need to change the way that we are doing science in a big way. We need to take that pressure off of scientists. We need to support them in saying, I didn't get this right. We need to support them in finding negative findings. You know, X doesn't do Y. You can't publish that anywhere. But it's important that people know X doesn't do Y. All those sorts of things. So some journals now are requiring the original images and blots. That's good. No more doctored images. Show us the original stuff. If we find evidence that you've been tampering with it, you're not going to get published. AI has actually made it much easier to find these things. Now we can search across images through hundreds of papers and journals much more quickly than humans could have. But the pressures are getting worse as funding is being frozen, and it remains frozen, and research funding is in a really tough place right now. Cancer research, Alzheimer's research, everything. The pressure on scientists to publish and be successful is higher than ever, which means the temptation to fudge those numbers is probably higher than ever. I think that it is more necessary than ever to advocate with patients on behalf of neuroscience and help guide them through these embarrassing and trust-damaging situations, and that's what Dr. Counts and I and others like us are here to do. We have been here, we are here, we will be here to help you. If you have questions about neuroscience, you want us to look at something, you are interested in a clinical trial and you want to know, what's the deal with this? We will discuss it with you, we will find other people to discuss it with you. Find your friendly neighborhood scientist, and the good ones will help you deal with this stuff. Again, it's not everybody. It's just that the bad ones tend to get more attention because of how bad they can be. And so we want to encourage you to continue. We need people to be in clinical trials in order to find a cure. It's the only way we're going to find a cure. But that increased skepticism and making sure you've got somebody on your team helping you is really, really critical. Sorry to end on such a downer note, but we want to be honest with you when things don't go well and help you navigate those things. So thank you for your attention.
Access Vision. Your voice, your community.